Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We're getting into the weeds a little bit with this one, Brad. So we're going to talk about the examination of the S1 nerve root. Everything you need to know, Bob and Brad.
That's right, Bob and Brad. We're going to show you this, and this is rather interesting. I think because you may find out if you go to the doctor and you have some pain going down your leg, they may mention which level it comes from. They'll say which level in there: L4, L5, S1, S2, etc. And this is going to explain to you the pattern of where the nerve physically goes and how the symptoms, if that nerve gets pinched, how you can test it at home.
So you may find if you have some of these symptoms, you may have an S1 nerve root problem.
Right, exactly.
And that may be a pinched nerve or a sciatic nerve or from sciatica.
Right, yep. We'll get into it as we go through it, but do we have to mention our giveaway?
Oh, yeah, that's right. We're doing a massive giveaway. We're doing 10 products. One person wins it.
Yeah.
One couple, if you want to submit it as a couple.
Right. It doesn't matter. But yeah, 10 of our favorite products that we use on a regular basis at home for exercising, blood pressure,
giveaway. Go to the giveaway section of Bob and Brad and sign up. You can also go to Facebook. It'll be pinned to the top of the page.
Exactly.
And what else do we have, Brad?
That's right. The podcasts are out there and they are rolling strong. Let's start with the anatomies.
All right.
So S1, what does S stand for, Bob?
Sacrum.
Sacrum. So here we got Sam, and this is kind of nice. It is Halloween just got done, so Sam was busy at work. He's resting. But the sacrum, I usually think of it as on the back side. It's that solid bone.
It's kind of a triangle shape.
Yep. And they were evidently vertebrae at one time, all fused together.
Right.
The nerve S1 is the next one down from L5, but it does not come out the back side. It actually comes out the front side here. Can you zoom in on that, Tanner? And this is just, it continues from here, goes down and goes into the nerve. Sciatic
nerve.
Right, and then goes all the way down into the leg. And we'll show you where this goes and what it...
So again, if your pain pattern follows that, you may want to pay attention to this.
Yeah, and we're going to show you exactly where you may feel at the sensation of that. So Sam, we're done with you. Bob is up next.
All right, you want me just to stand?
Yep, stand up, Bob, because Bob volunteered to show. We've got a pink piece of tape here, kinesio tape actually. This is where if you feel numbness, tingling, any unusual sensations that have this pattern going down the back of the leg.
Obviously not over the pants.
Yeah,
I didn't want to stand here naked with my butt hanging out.
Exactly. You can stand up tall, Bob. You don't have to be all...
I just want to...
All right, whatever turns you on. Goes down here around the heel, and then when the nerve comes down, it's only on the side of the foot to the pinky toe, the smallest toe.
Outside of the foot.
Yep. Now, there's a little variation from person to person, but this is S1 generally. If you feel it on this side of the foot, it's almost certainly not S1.
Or top of the foot.
Yep. So we call that the dermatome in the medical field. So if you feel that area, possibly an S1 problem, now you can do the strength test.
Sure.
Because this nerve is responsible for certain muscle groups in the leg and all the way down to the foot.
Right.
And there's a number of them, the glute max, there's a hamstring in there, but we're going to focus on one of them that is not one muscle, but one group that is responsible from S1 innervating it. And that is simply going up on your toes like this. Now, if you have a serious S1 compression problem, you may not even be able to do this.
Right. You may be able to do it on the other side.
Yep.
That's a good test.
Yeah. Test the good leg. You should be able to do, a healthy person, average age up in the 50s or 60s, possibly if they're active, should be able to do 10 of these with, I've got one finger here for balance.
Right.
And I'm feeling fatigued.
Should be difficult.
Yeah. And then test the other one. Maybe you can do it, but by the time you get to 5 or 6, it's getting difficult.
You can tell the difference between the two.
Your balance is off a little bit. That's another sign. So you're going to do each one of those tests.
Right.
The next one.
Straight leg raise.
Straight leg raise. And this is one that you have to have another person. I'm glad you picked that side, Bob, because we've got
That's what I thought. I
yep,
was thinking.
yeah, exactly. You can't get anything past Bob. He is right on the ball. He's Johnny on the spot,
Yeah.
Bobby on the spot. So knee must stay straight. The person relaxes. The other person comes up like this, and that person, Bob, will respond.
Starting to get tight. It's
Yep.
starting to hurt.
And it may feel, you may feel pain anywhere along the leg, all the way up into the back. And if I go like this, it makes it clearly worse.
And if I bring my head up like this,
Yeah.
that might make it worse too.
Exactly.
Like this, and I go like that.
Right.
We're stretching the nerve along the entire, through the canal and everything.
Right. So if this nerve is irritated or pinched, this, it may hurt at this level.
Right.
Then we go to the uninvolved leg, and it's like, oh, it goes way up to here, and I do
Right.
this, and he feels
Oh,
a normal muscle
exactly.
stretch.
Right.
So you always compare one leg to the other. So that's typically that one is pretty clear. I think even
Right.
the layperson will be able to do that if they follow our instructions.
Very common test, straight leg rest test that they do on herniated disc.
Yes, exactly. Now this last one you could try, but it takes a little practice. Sometimes
Yeah.
it's from the professional, but it's a reflex test, and that's where's my hammer? Oh, here it is. You go into the doctor's room or the therapist or whoever, and they'll pull out a little hammer like this, and you don't have to worry they're not going to bunk in at it with it. Hopefully, it's just a reflex test. The typical one was where you hit on the
Right.
knee, and your knee jerks a little bit.
Right.
And how your muscle responds can give good information on the nerve, if the nerve is intact or if the muscles are working the way they should. And a grade, there's 4 grades, 1, 2, 3, 4. We're looking at a grade 2, and you'll see on this quadricep, if I do that and I get a little response right there, that would be normal. If you do this and there's no response, it means there may be a problem,
Right.
but not necessarily.
Yeah.
So
And unfortunately, as you get older, they tend to. Mine are not real active, so we're actually going to bring Tanner in.
yeah, he's our
cameraman.
camera person, Bob.
And it gives you a chance to see Tanner.
Yeah, really. Tanner, don't be shy. Come on out. There's different ways to do this. It can be done in the seated position, but your doctor or therapist may have you do it this way. And can you move this foot forward just so they can? There you go. And just relax. There we go. I'm going to go like this. They'll take the reflex hammer, put a little tension on the Achilles tendon, and simply go like that. And if you watch his foot, relax again, Tanner. I'm not going to tell you when I'm going to do it because I could do it in a minute from now or now. Did you see that foot? There's a jerk right there, and that would be a normal reflex. You do it on the other one, and we did this before, and he has the same on both sides.
Sure.
If you do this and it goes more than once and it starts doing this, that's called clonus.
Right.
That's abnormal.
Right.
If you do it and there's nothing going, he's got a pretty good one there. It's
Yeah.
kind of fun.
Yeah.
That doesn't hurt, does it, Tanner? No, it's a fun thing to do, and you can do it just with your hand. I've done this
Right.
before.
I've done that before
Yeah,
too.
so you can try that. You're not smacking the person. It's just a gentle,
Right.
and it's a reflex that the muscle does. It's kind of fun to do. That's kind of having fun there. Okay, again, this is something that probably you won't do at home, but you can just like that and see how it goes. And again, compare right to left. So that pretty much takes all of the tests that can be done pretty efficiently.
Yeah, if you find all of them are there, all of them are present, like you find a dermatome, like we said, your strength is decreased, the reflexes decrease, you have an S1 problem.
Yeah, and a straight leg raise, if all those are
Right.
clearly positive, S1 is a problem. And
You can impress your doctor by saying, I think I have a S1 nerve root problem.
right, you can say, all my tests were positive. The straight leg raised,
Yeah.
reflex test, a dermatome. They'll say, oh my goodness, why'd you even come in?
Yeah,
And so that's a good point.
that's right.
All right, good luck with it. Now you understand it.
Thanks for watching.